Good morning, good afternoon, good evening, wherever you are in the world, and welcome to this UAR webinar on how many dogs are there? Practical methods for dog population estimation. My name is Dr. Ellie Hebe, and I'm the director of the ICAM Coalition. I'm going to start today with a little bit of housekeeping. We are not in webinar format today, so that means please keep your microphones muted unless you are invited to ask a question. If you are unmuted, we will all hear you. So please keep an eye on that mute button. We do have the Q&A function running, so please do put your questions in there so that presenters can either answer in text or request to answer live during the panel discussion at the end. And feel free to use the chat function to say hello, tell us where you're joining from, share your thoughts, ask any logistic questions, and we'll also be dropping useful links in there for you. All right, let's get on with the webinar. So today, myself and three of my co-authors will be giving you a brief overview of this new guidance document that you can access on the UAR website. You'll find a link going up in the chat shortly. There is a wealth of other tools and guidance on the UAR forum website, so please do take time to take a look around. But today we'll be focusing on this newest guidance document. We'll each cover a different methodology, as you can see on the slide here, and I'll introduce you to each of our speakers as we go. We hope this overview will help you to use and navigate this document efficiently and pinpoint exactly the parts that are most relevant to you and the dogs in your context. At the end today, I'll invite all the speakers back to the virtual floor and we'll have a Q&A session as a panel. But allow me to begin. So knowing how many dogs you have is an obvious requirement for planning dog vaccination. How many vaccines, sent to where, with what cold chain capacity, with how many people for how long. Those of us with planning and budgeting responsibilities need a number of dogs for each location. Answering this question, how many dogs, can be done in different ways, from very simple and immediately accessible methods through to the relatively complex methods that require investment in field research time. And this is what this guidance covers, your method choices, when to use them, in what context, and how to implement them so you can see whether they're viable for you. So this guidance focuses on free roaming dog estimates. So free roaming dogs are the most epidemiologically relevant for rabies because they have the greatest contact rate with other dogs, placing them at highest risk of rabies transmission, and they're therefore the primary targets for vaccination campaigns. Now, free roaming doesn't necessarily mean unowned. Some will be unowned, but others are owned dogs that live unconfined. And you'll hear this distinction become important as we work through the available methods, because the ownership status of free roaming dogs in your geographical area of interest will dictate which methods of estimation are most appropriate. So today, I'm starting off with the most simple method of all, which is the application of existing human to dog ratios. So the human to dog ratio, or HDR, is a simple calculation that assumes that you can at least find out how many people live in the area you intend to vaccinate. Dogs are reliant on resources provided by people. Therefore, the number of people living in an area is a reliable predictor of the number of dogs likely to live there. However, HDRs are influenced by several factors, including human density. So in high-density urban areas, particularly where people live in high-rise accommodation, space available for dogs is more limited. There may be more than 1,000 people living in this particular block of flats, but just a handful of free-roaming dogs living in the open space below. Therefore, there are typically fewer dogs per person in urban areas than the average HDR for the country would predict. At low-density rural areas, where more habitat is available, there may be more dogs per person than national or regional averages would predict. But how do you know what the HDRs are for your country at these different levels of human density? Well, if you take a look in the UAR forum toolbox, and the link to this is in the guidance document, you will find this human to dog ratio and dog population estimate repository. and a link to a downloadable Excel file. In this file, you will find a tab for every region, and for many countries, an estimated human to free-roaming dog estimate at 3 levels of human density and with different religious majorities, with the source of these numbers provided alongside, usually from published papers. Now, there are gaps, countries without data, but there are regional averages that you can use if your country is one of those gaps. There is a worked example in the guidance document for how you can use human population estimates, whether from your most recent national human census or from local government data, and apply these human to dog ratios to get your total free roaming dog estimate. Now, this is something we can all do today without even leaving our desks. To get an estimate of dog numbers for a particular location, whatever the size, a whole country if you need that. Using published human to dog ratios to estimate dog numbers won't be perfect, but it will be good enough to get started. The important thing is this: not knowing the exact number of dogs should not stop us from planning and implementing dog vaccination campaigns. Vaccination is essential for controlling rabies, and it should go ahead even if our dog numbers are not exact. So later today, Maganga will explain how we can use information from our vaccination campaigns to improve our estimates. So even if we start with a rough number, it will get better over time. Each campaign helps us in 2 ways. We protect public health and we learn more about our dog population. This means that our planning becomes stronger and more accurate every year. Now, some of you will have resources to invest in new estimates. You perhaps have good reason to be concerned that existing HDRs are not reliable. Perhaps you know the studies that these came from and fear that the study sites used were not representative. Or perhaps there are no specific HDRs for your country yet and you are using regional HDRs. So the question becomes, which method do you use for these new estimates? So today we'll explain when to use household surveys, direct street counts, and then post-vaccination surveys, which employ mark recite methodology. We will not be covering capture, mark, recapture in detail today. This is perhaps the most demanding method in terms of resources to implement and analysis capacity. The guide provides a great summary of the options available for applying this method. It's probably most appropriate when you need a precise estimate of the free roaming dog population within a relatively small area. What I encourage you to do with estimates resulting from these studies is to translate them back into HDRs. If you can repeat these estimates across multiple locations, you can then start comparing HDRs between sites. Ask what explains the differences. Is it human population density, the dominant religion, or perhaps there are other factors? Perhaps socioeconomic factors that are also measured in human censuses. Or perhaps human density is a good enough explanatory variable in itself. Once you understand these predictors, you can develop more refined HDR estimates for your country. This means you can extrapolate your dog estimates to unstudied areas in a more robust way by accounting for their specific characteristics, such as human density, religion, and other relevant influences present in those locations. One option that produces not just refined estimates for actual maps is called the STARK method, and STARK stands for Settlement Type and Road Connectivity. So existing formal administrative boundaries of urban and rural areas can be problematic. Think about how much human density varies across a whole metropolitan area. And also the issue of informal urban sprawl, meaning that a city can quite often outgrow its formal administrative boundary. The STARK method instead conceptually chops the whole area into hexagons of about 1 kilometre squared and goes beyond only census information and instead uses other publicly available information to score each and every hexagon for both human density and road connectivity, so that you can get gradings from highly dense, highly connected urban areas through to rural areas that are connected to other settlements, and then rural areas that are really quite disconnected from other settlements. It then applies the range of available HDRs across these categories of urbanisation to get a free roaming dog population estimate for each hexagon. This results in high resolution maps that visualises both the dog population and potential transmission hotspots. So the image here is the output for N'Djamena in Chad. Those of you that know this city may note that this map actually shows information about dogs in those areas that fall outside of Chad and within the boundary of neighbouring Cameroon, because we know that neither dogs nor viruses respect international borders. Stark also provides numerical estimates of the dog population size at whatever geographical level that you need by combining the totals from hexagons that fall within specified geographical areas. If you would like to learn more about Stark, there is a presentation by Cassie Bertel as part of a previous UAR webinar. The link for this is going up in the chat shortly. And there's also a publication that explains this method in more detail. Again, the link will be in the chat. But know that you can also email the US CDC to ask for a Stark map to be created for your area using the email on the slide here. A final point, this Stark model and any extrapolation that we may calculate is dependent on the quality of data, the parameters that we input into the model. So the purpose of this new dog estimation guidance is to help you calculate accurate estimates in a sample of areas so that you can feed your models with quality inputs, leading to increasingly accurate extrapolations to your dog population estimates across your entire area of interest. So you are not reliant on repeating time-intensive research in every location. So back to the question, how do we estimate dog populations to create these accurate parameters? And now I'm going to hand over to my co-author and colleague, Dr. Karma Rinzin. He is the Regional Animal Health Coordinator at the Southeast Asia Sub-Regional Office of the World Organization for Animal Health. He has substantial experience in dog population management and rabies control, and his PhD thesis focused on the population dynamics and health status of free-roaming dogs in Bhutan. And today, Karma's going to provide us an outline of the method of household surveys. So if I stop sharing my screen here, if I can invite Karma. Hi, Karma, how are you doing?
Yep. Hi, Kelly.
Hi, I'll allow you to share.
Can you? Okay.
At the moment, we're seeing the full screen, not just the slideshow. I don't know if you want to put it into slideshow mode.
Yeah. Can you see this? I've already put in slideshow.
Perfect. Done. It looks great. Thank you, Karma. I shall let you carry on.
Thank you, Eli. So, okay. Good. Thank you, Eli. Good afternoon, evening, and maybe morning also, because the participants are from all parts of the world. So I'll be basically talking on the household survey, and then the order of my presentation is when to use, what is household survey, then what do the household survey result tell us, what are the tools that we use, how to do the sample size calculation, then on the selection of the households, then little bit on the population studies, and then some case studies, and then briefly touch on like how the household survey can be used to estimate the vaccination coverage. So before I move further, as Eli has said, like basically when you talk about dog population, it's about the own dogs and unowned dogs. And then when we see free roaming dogs, it means that the free roaming dogs are like owned, but then not confined or supervised, and then also unowned dogs. So that's why it's really important to understand this concept. And then when to use this household survey is when there is a high confidence that the vast majority of the free roaming dogs are owned dogs that roam without supervision. So I already touched on the types of free roaming dogs. And then one thing which we have to note is rabies virus transmission occurs between free roaming dogs, regardless of whether they have a owner. So that's why it's really, really important to sort of understand the like really sort of target the free roaming dogs in our rabies control program. And then also the estimation of the on-dog population through such survey is also maybe useful when there is no reliable dog registration system. So when I say what a household survey, it's usually sort of conducted through either visiting a household or by making a call or maybe sending running an online survey questionnaire based on the selected sample of the households. And usually the key questions asked to the household members are like the number of people in the household, because, and then whether they own dogs. If they own dogs, then how many dogs they own, because this helps us to estimate the human dog ratio. And then, as I said, so basically, the result of this survey will help us to estimate the human dog ratio and then eventually extrapolating the total dog population using a human population data. So it's like basically total human population multiplied by the human dog ratio. And then also like from the household, we can also sort of understand the ownership pattern or the percentage of dog owning household. And then we also come up with an estimate of average number of dogs per dog owning household. And then basically we multiply the number of dog owning household by the average dogs per dog owning household. So this will also give an estimate. The choice is depending on the availability of it, because in some countries there's a good data at the household level, but then in some countries there's a very good data on the total population, human population. So the choice is depending on the availability of the data. And then what is important is also when we do the household survey, it's also important to check the dog confinement status and vaccination status. Because like when we sort of ask, not only just asking the owner whether they have a dog, if you're visiting the household, it's also important to check whether the dogs are seen confined or whether the dogs is not seen in the premises or is outside the. So it's really, really sort of important to check that, even it's not only just asking the owner, but also physically check if you're visiting a household. And then also, like, it will be good to sort of ask the vaccination status, because then this will also give us a good estimate of how many dogs are vaccinated. So some of the important tools, I think I already touched on this survey questionnaire. It should standardize questions to ensure consistency and data quality. And then also we need to seek the consent of the owner to participate in the survey. And then usually you should only sort of include the respondents should be at least 18 years and above. And it also may vary from country to country. And then, it's also sort of use some relevant statistical tools to estimate the sample size to ensure representativeness and precision. And some example of the survey tools is EPI tools developed by us with, and then there's also some very good sample size calculation tool developed by Melbourne University. And then also data collection platforms, because that it's also really, really important, because the work that I did in the past, I usually use the EP Collect 5, which is very good. And then other tool that may be considered is Kobo Toolbox. And then both these platforms are again we can use this platform on the mobile phone while carrying out the survey. So that will really make the work easier at the end, because firstly, from this platform, we can exactly monitor where the survey enumerators have gone, because it has also feature of GPS locations. And then also we can sort of closely, so there are a lot of advantage of sort of using this type of data collection platforms that are that can be also used on the smartphones. And then another important thing is, as I said before, like government household statistics, like human population or household data. and because these are basically used for extrapolating the dog population estimates. And then coming to the sample size calculation, this is just an example, like sample size to estimate proportion or apparent prevalence with specified precision. Like as you can see, how a household survey is planned in a different region to estimate the proportion, right? Because you're just putting that the expected dog ownership prevalence is 45, then desired prevalence of 0.05, and then also 95% with a 95% confidence interval. With these inputs, we get the estimated sample size of 381 households. So this is just an example, which is also there in the uh, guideline. And then I also forgot to inform because even the guideline has the sample survey questionnaire, which can be adapted for your use. Now coming to the selection of the households, because like when you talk about this, like because it has to be firstly random, and then like so the best the number of the dogs or the distribution of the dogs may vary between an urban, rural, or even semi-urban. So that's why it's best to go for multi-stage cluster sampling to ensure representation across urban and rural areas. So first stratify by rural and urban. Then within this true strata, so select the specific villages or block randomly from these two or from different strata. And then within that stratum, again, further randomly choose the house or household, and then yeah, because then you proceed with the survey questionnaire. So I think I don't have to tell that if the household declines to participate or is not home, the next household is selected, and then using because that can be defined in the survey criteria even before we move ahead with the survey. And then coming to some of the example of how we can use this household survey to estimate the dog population. This one is the example of survey which we carried out in Bali, in Indonesia. So, like as you can see, we surveyed around 1,624 households, out of which like 854 households have dogs, 52.7. And then we have the total household number in Bali is around 1.144 million. And then from that, we came up with the total dog owning household by multiplying the total number of household with the proportion of the dog owning household. And then from the household survey, we also came up with the average number of dogs per dog owning household, which is 1.84. And then we come up with the total dog population by multiplying the mean number of dogs by the total number of dog owning households, which is shown here. So yeah, so the total owned dog in Bali is little over 1 billion. And then this is an estimation of owned dog population based on the human dog ratio in Bhutan. So here, like again, we did this survey, like where like 1301 respondents were interviewed, and then we came up with the proportion of the dog owning household in the rural and urban. So in urban it's 24.4, in rural it's 40.8, and then also like from the survey, we also sort of get, because we also asked how many people are there in each household. So from this survey, like this is the total number of human, like 3865, and this is 2976 in the rural areas. And then from this, we came up with the human dog ratio of 16.31 human per dog in urban area, and then in the rural area we came up with 8.43. So based on this, we sort of extrapolated to the total human population basically, yeah, based on this, so we extrapolated, and then the total dog population in urban household or own dog population in urban is 15,663, and in the rural is 55,000, little more than 55,000, and then total is close to 71,000 dog own dog population. So this is just an example how we can use this human dog ratio from the survey. And then now briefly touching on how we can use this household survey to estimate the vaccination coverage. For example, N1 is number of on dogs vaccinated and marked with a collar during the vaccination campaign. This is N2 is 32 is total number of dogs that are cited with and without collar during the follow-up household survey after a few days, 32. And then M is 18 number of dogs that are cited with a collar during the household survey. And then we can sort of come up with the estimate of 56%. This is just a small example how we can use the household survey to sort of estimate the vaccination coverage. And then also using the Lincoln-Peterson formula, we can also sort of, this will help us to refine our dog population estimate, which our colleague, Dr. Maganga, will cover in his presentation. So coming to conclusion, yeah, so household survey is a reliable method to estimate the on-dog population. And then also it provides key insights of human-dog ratio, ownership pattern, vaccination coverage. And then it helps in better planning, thus supporting the vaccination campaign and also resource allocation. And then also use of simple tools really helps in improving the accuracy and planning. So the key takeaway is this type of survey will help in better dog management and disease control. And then I would also like to conclude that combining a household and a field survey improves the population estimate, overall dog population estimate. With this, thank you very much, and back to you, Dr. Eli.
Thank you, Karma. Please do add any questions that you have for Karma or any of our other presenters into the Q&A function, and we can either type in the answer or we will answer those questions live at the panel discussion at the end. But I'm now going to hand over to Tamara, who will be talking us through the method of direct counts. So Tamara Kartel is the Global Senior Specialist at Four Paws International. Her expertise is in monitoring and evaluation of street dog and cat programs. She holds an MSc degree in animals and public policy, and her global role at Four Paws, she's responsible for both policy as well as the strategic development and monitoring and evaluation of companion animal programs. Okay, Tamara, allow you to share your screen.
Hello. Can you hear me?
We can. And
Perfect.
now we can see your slides perfectly. Thank you very much. Over to you.
Excellent. Let me just double check if this works. Yes. Okay, awesome. Thanks so much, Ellie. Well, I can only say good morning, good afternoon, or good evening as well. And thanks for joining us today. I will be presenting on direct street counts, as Ellie mentioned, and as one of the methods that you can use to estimate free-roaming dog populations. So direct street counts are a low-cost direct observational survey method suitable for urban, suburban, and rural areas, while sampling design may vary depending on the setting and survey team size that you have. However, the overall protocols and technological requirements remain similar. So regardless of what you might be looking at, this might still be applicable. So direct street counts are used in situations where a significant proportion of the free-roaming dogs are unowned or community owned, and therefore would not be captured through a household survey that Dr. Karma just explained. So they usually are a good combination if you have a mixed population, or you think that you have an assumption that some of the dogs might be, or most of the dogs or whatever, might be owned but roaming. They're also appropriate where many owned dogs are unconfined in populated areas, such as around houses, slaughterhouses, or waste disposal. And for me, recently, it was industrial areas, just to give you another example. This method relies on the fact that dogs are visible on streets at least once or twice a day. And it is particularly useful when the area of interest is too large or full coverage using mark recapture methods is maybe too difficult, and where resource constraints require a lower cost approach. Lower intensity and time commitment, both in the field and the analysis afterwards, are also, I think at least, one of the selling points of this method. In these situations, an approximate estimate of the free roaming dog population is perhaps acceptable, and an estimate generated with this method may later be refined using post-vaccination surveys, as Ellie already mentioned, which will come later. So the objective is typically, when you use this method, to create an acceptable level of accuracy rather than to generate a highly precise population estimate. So once we have decided that this method is the method that is suitable for your objectives and circumstances, the first step is to define the area of interest. This is just one of my projects in Romania, for example. So if the area is too large to survey completely, a representative sample should be selected. And there are two options: either survey all streets or use sampled routes. If routes are used, they must be unbiased with respect to unknown dog densities, and should cover a wide range of land use types as well as human population densities. This is important because dogs are not evenly distributed across an area and tend to cluster around what I mentioned earlier, around these hotspots, so to say. So by covering a variety of conditions, the selected streets are more likely to be representative of the wider area. So once you've designed your street counts, timing is critical when conducting these street counts, because surveys should be carried out during peak roaming hours, typically at dawn and dusk, but that might be different for your situation. They should avoid extreme weather conditions, holidays, unusual activity periods like market days or something, as these may affect dog visibility as well as their level of activity at different times. So in preparation, surveyors must be trained in dog classification, such as distinguishing puppies from adults, which sounds intuitive, but there are a lot of opinions around puppies versus, or when puppyhood ends, and obviously what vaccinated and unvaccinated dogs look like. The use of mobile data collection applications as well as safety protocols. Mobile data collection apps tested and recommended for dog surveys are the Talea Street Survey app from ICAM, as well as the World Veterinary Service data collection app. You can read more about these in the actual document. Both applications require a short training and require only a novice smartphone user expertise to be operated accurately. So that makes them really usable and user-friendly. And they both also conform to GDPR regulations if that is a concern. So consistency, timing routes and methods is particularly important when surveys are repeated over time, as these strongly affect the results. Further street counts are typically conducted by teams of 2 surveyors in my surveys on 2 consecutive days, and within those teams, one person focuses usually on navigation and movement, while the other observes and records data. But often the teams find their own dynamics where they make sure that they do both really well. On foot, a team can cover approximately 6 to 7 kilometers per hour, and by vehicle, like a motorcycle or even car, around 10 to 15 kilometers per hour. But that also depends on sometimes the number of dogs that you encounter, but also the topography. So for each dog cited, the minimum information recorded for rabies projects is age, classified as adult or puppy, and vaccination status, recorded as marked or unmarked. Additional characteristics can be obviously, or can be collected in the application, such as sex, health indicators, or signs of ownership. but that depends really on the scope of the project and if you may have ambitions to expand the project, for example, include CNVR or other things. So recording each dog should also not take more than 10 seconds. So these street counts should be quite quick and efficient. So using the minimum data set that I just, or data recording set that I just mentioned, you have a couple of variables that you're measuring. So the number of free roaming dogs per kilometer of streets surveyed, or the number of dogs per sample area when all streets are counted, as well as the proportion of vaccinated and unvaccinated dogs and the proportion of puppies. But to generate the estimate, the key output is the number of dogs per kilometer of streets surveyed. This density can then be extrapolated using the total street length to estimate the number of dogs visibly roaming on public streets at the time of the survey. Street length is used because dogs are strongly associated with streets, which provide habitat for movement, but also for rest, access to food, and yeah, just in general, like that's where we see them. Street length is used, no, what am I saying? However, because street density varies widely, extrapolation by area tends to be less reliable than the extrapolation by street length. I would like to note here again that this approach estimates only the number of observable dogs and therefore underestimates the total population. And for that reason, estimates should be corrected for imperfect detection or by a detection probability factor. So detection probability refers to the likelihood that a free roaming dog present during a survey is actually observed and recorded. So for example, if a detection probability is 0.5, that indicates that half or 50% of the dogs present at the observed are observed, while the other half are not detected at the time of the survey. So that's where the underestimation comes in. So where possible, and Ellie sort of touched upon this, detection probability should be estimated during capture mark recapture methods in the same area you are doing the street counts. And if you have the time and resources to do your own mark recapture surveys, that is brilliant. And the chapter following this one in the document outlines them, what methods exist and are useful and how you can use them in your program. However, this is very often not possible for most programs. So we recommend to either look into this chapter in the document and see if any of the published detection probabilities listed there might be useful for you. Or if nothing in your country is available, we suggest to use 0.4 as a general detection probability. And that is based on our collective experience, and a worked example can be found in the chapter. So if you're interested how that is in detail worked out for a project, then have a look there. But I also wanted to share a very quick one here without going into too much detail, where you can see that in my surveys with our team in Siem Reap in Cambodia, you can see the simple extrapolated estimate, and then you can see the one that I corrected with a detection probability that we found in our mark recapture surveys. We did a lot of work there, but this is what it comes down to. So you can see that the total estimates that are not corrected are massively smaller than the ones that are corrected, and that's obviously when you want to hit your rabies vaccination targets, that's important. And I just want to end on pointing out the strengths again, but also the limitations of this method. So direct street counts are a low-cost direct observational method that is suitable for urban, suburban, and rural areas. They are accurate and inexpensive, although not necessarily precise. They are also suitable for repeated surveys, allowing monitoring of changes over time using indicators of abundance and welfare. But there are limitations. So it counts only visible dogs and therefore requires correction for imperfect detection. And as a result, it provides an approximate estimate rather than a highly precise population size. The question if you really need a precise population size, because you can refine your estimates once you have started. So this might still be the most low cost, low intensive, and best suitable method if you want to estimate the number of dogs at baseline. And with that, I thank you for your attention and hand over to Ellie again.
Thanks, Tamara. That's great. Again, to all of you listening, please do add any questions for Tamara into the Q&A box. We've spotted a few in the chat that we'll ask her during the final session as well. But if you can put them in the Q&A box, that's ideal. And I'm now going to pass over to Maganga, who will be providing an overview of using vaccination coverage as part of applying a MARC resite method of population estimation. Dr. Maganga Sambo is a research scientist based at Ifakara Health Institute with over 15 years of field experience in the design, implementation, and evaluation of mass dog vaccination programs. His work focuses on improving the effectiveness, efficiency, and scalability of dog-mediated rabies control strategies in low and middle-income countries. And he'll be covering vaccination coverage today. So Maganga, handing over to you. I can see your slides. Looks perfect.
Oh, hello everyone. Thank you, Ellie, for a nice introduction. And I'm going through on how we can use the transect surveys to evaluate rabies control efforts. Unfortunately, my internet is very low, so I won't turn on my video. Please bear with me for that. So we all know that we have the target, a 0 by 30 target, and in order to achieve these targets, we need to vaccinate 70 and achieve 70% coverage of susceptible dog populations. And in order to estimate the coverage, this is a very simple formula that you need to have a count of vaccinated dogs, but also you need to have the total dog population size. Actually, you can get the number of vaccinated dogs from the registers of the vaccinated dogs. However, in areas where rabies is endemic, dog population size or census is missing, and this is a big problem because you cannot estimate a coverage for that. However, the only way we can rely on the post-vaccination evaluation and every method, and these are the few methods that we can use to calculate for coverage. And as has been explained, every method has limitations and strengths. For instance, dog census is a gold standard, but it's very expensive and labor intensive. So, and for the transect that I spend most of my time to explain is only can count ownerless free roaming dogs and owned free roaming dogs, but it cannot count the confined dogs, especially for the dogs that has been fenced in the houses that we can't capture. However, these are not susceptible because they are protected within the house. So the question about conducting post-vaccination transects, the first thing is we normally conduct transect immediate after vaccination. For experience in Tanzania, our campaign normally runs from morning to 3 p.m. and the transect we have been conducting from 4 p.m. the same vaccination day, and then we do the morning, the second transect survey. So we have been seeing a lot of advantages for fitting the collars. For us, we have been using to fit the collar so that the next day you'll be counting the dogs with collars or the vaccinated dogs, and you'll be counting the dogs without collars, which indicates the dog was not vaccinated. So it has been creating a lot of awareness about the campaign, and when people they see the dogs with collars, they know something is going on here, and someone will land back to their homes and take their dogs for vaccination. But also in terms of the cost, I think this has been cheap because we have been training the local communities with the mobile or with the smartphone to conduct the transects. And this has been a popular incentive for owners to bring their dogs for vaccination because they will see their dogs has been marked. And then this transect has been so very useful for quick coverage calculation to see how many dogs which are marked, which indicates has been vaccinated against how many dogs which are not vaccinated. But also this is cheap because it's not require manpower. It's the owners who can put the collars, and this is relative cheap. Next slide, please. So after vaccination, as I know, you put the collars and you give the dog owners the vaccination cards, which come as explained for household survey. But for transect survey, we need to put a mark and then you assess. Next, please. And then you measure the campaign performance, and if the 70% coverage has been moved, and then you move to another area, you move to another village. Next, please. But what happens if the campaign, the performance of the campaign didn't reach 70%? This is a great opportunity for campaign organizers to brainstorm what happens, why the campaign didn't reach 70%. Is that because of the location of the central point? It's because of advertising issue, procurement issue, or community awareness. So by doing that, and then you need to, by doing a quick assessment using transect survey, it gives you an opportunity to brainstorm for the challenges. Next, please. And then when you try to understand the reasons why there was poor performance, and then you can recommend to do a remedial or to repeat the campaign in the areas which didn't achieve 70%. Next, please. So the second reason why do we need to measure coverage is to identify the poor performing areas or areas accidentally missed during the campaign. We know that sometimes the campaign organizers do miss these areas, and these areas with poor performing or have been missed can be the source of incursion of rabies. So it's very important to measure, to understand which areas has been achieved and which area didn't achieve, so that if we understand the problematic areas, it's so easier to target them for the remedial vaccination campaign. Next, please. And the third reason why do we need to measure coverage is to estimate or to revise dog population size. So as I just provided here a simple formula that you can use to calculate dog population size in your area. If you vaccinated 50 dogs, and then after estimating the coverage, you find that the coverage was 50. It automatically, you know that in this community, we just have 100 dogs where 50 were vaccinated and 50 were not vaccinated. Next, please. So if you check from this graph in the boxes labeled with number 1, you have the initial dog population size, and if you have sensors or if you have human dog ratio, you can use that, and then you can use that to start the campaign. And then when you have the campaign, you know that you can, with this initial estimate will help you to have the campaign planning, like how many vaccine do you need? And then the third stage, you will procure the vaccine, and then you vaccinate. And then after having the vaccination, and then you do the post-vaccination evaluation. And then after doing the assessments, and then you can use the assessment to refine the dog population size. And then you move to the boxes with number 2. You refine the dog population estimate. After refine for the second round of vaccination, after refining of dog population estimates, and then you refine the vaccine requirement. Probably you over procure the number of vaccine, and then you need maybe to use the remaining vaccine, or to procure the low number of vaccine. And then after that, you can adjust procurement order based on the refined dog population, and then you can repeat the same process. And next, please. And then the fourth importance of measuring coverage is for mark and recapture probabilities. Through my experience, when you conduct transect survey, you need to conduct a transect survey when dogs are active. And this is during the evening or early in the morning, because during the afternoon it's super sun and most of the dogs will be hiding in the sheds. So detection is and when you are doing transect, is the probability of counting puppies is very low. So we need to when we are doing that, so when we are doing transect survey, it's easier. It's so easy to know how are we going to do that. This has been captured by Tamara, but this is a simple formula for mark recapture probability. So by doing transect, it will help you to estimate the true population size. It will help you to collect, estimate vaccination coverage, and quantify for uncertainty. You need to adjust it for the puppy. You need to have the adult to puppy ratio, so that when you are calculating for population size, you need to take into account for this ratio of the for the adult to puppy ratios. And next is slide, please. And to make the conclusions, so what we have been experienced that monitoring coverage is very critical, although we know that this part is most of the neglected part of the campaign, but this is very crucial for improvement of your campaign. Coverage explain the campaign success, and we can use this to improve for planning for the next campaign. And then when we have established or refined dog doses, we can use that to plan for the subsequent years following the transect surveys. Thank you so much, Ellie. Over to you.
Hi there. Thank you so much, Maganga. I really appreciate that. It was a great presentation. Thank you to all my speakers. We're now going to go into a panel Q&A session. So please do add questions into the Q&A box. And we've also pulled a few from the chat as well. So I'm going to start with some questions now for Karma and Tamara that have been shared in the chat. And then I will ask a generic one to everybody, which is about I can let you to prepare. Afterwards, I'm going to ask you to tell me what is the most common mistake you see from programs when trying to estimate dog populations. But let me start with some specific ones. So Karma, one of the questions we were asked was around the number of days between a vaccination campaign and then looking at the number of collared and uncollared dogs that are counted. I know Maganga covered some of this as well. So maybe you can both answer that question for me.
Yeah, thank you, Ellie. Yeah, because like the topic which I was trying to address was on the household survey. So it really depends, because like it's not even really necessary to sort of mark the dog for the household survey, because when you visit the households, we exactly like owner will be able to tell whether the dogs had been already being sort of taken or being vaccinated in the past 1 or 2 days or few days before that. But then when it really comes, I think the use of collar is maybe in some communities is relevant when the large proportion of these own dogs are roaming. So maybe then collar may be also useful to sort of identify the dogs that are being vaccinated and not vaccinated. So that's why I think like during the vaccination campaign, irrespective of the owner's status, some in some campaign they mark the dogs with a collar. But then it's actually, again, very hard to say. Maybe Dr. Maganga will be in a better position to tell like the collar retention rate, because like if it all depends on like after how many days you carried out this post-vaccination survey. If you do it in a very short span of time, the collar may remain. But then like also, then if you take more time, the collar retention may be low. So maybe Dr. Maganga will be in a better position to tell on based on his experience, or maybe even Tamara, since yeah, he had been sort of involved in the field.
Very good. Maganga, are you there? I noticed that I can't see your video at the moment, but I think that may be because you've switched your video off to save internet access.
No, I just re-emitted him. It popped up. I
Hi,
think we lost
Maganga.
him.
Hi there, Maganga. I think we lost you momentarily there. The question was whether you had any information on collar retention, the sort of collar loss rate following a vaccination campaign, to help people to understand how quickly they want to move into looking at vaccination coverage after a vaccination campaign. What timelines do you suggest? Hi.
Oh, thank you, Ellie. To me, I think because we have been using the temporary collars, which are very cheap, and then I recommend to do transect immediately after the campaign and early in the morning. I think within 2 days or 3 days maximum, because of the type of the collars, because we don't want the collars to be expensive than the vaccine. We want to be cheap. But if you're using super expensive collars, I think it can take a little bit longer. Thanks.
Thank you. And tomorrow, I think you mentioned looking at vaccination status of dogs as you're doing direct count. So I assume you were meaning in the same scenario where there's been
Correct.
marking during vaccination. Okay.
Yeah, since we were talking about rabies programs, yeah, for sure.
Very good. And then I have a couple of questions tomorrow specifically for you. So one was around how do you get the corrected total estimate? So you talked a little bit about detection probability there.
Sorry, my cat is joining the
Your cat's
conversation.
trying to get in on the action here.
Yeah, that's a really good question. So when we talk about simple estimates, it's basically the dogs that you see per street kilometer surveyed, and then you extrapolate that to your total street length of your area. So that would be like your estimate. But the corrected one, where you factored in and you use the detection probability to sort of correct that simple estimate to an estimate that's more accurate, because you will only see a certain percentage or proportion of the total dog population at the time of your survey. So let's say you look at the document and the table doesn't give you a detectability, or you don't do mark recapture. We suggest you use 0.4. So basically you just correct your simple estimate with that, and then as you saw in my table, perhaps you can see that it corrects them by giving you a larger number of dogs, because that's the actual, or more closely to the actual number of dogs that live there. I hope that answers that.
Thank you. The other question that was asked was around direct street counts. What criteria do you use for choosing the streets within the selected areas? So how do you create those transects?
That's a really good question, and I think that's where sort of like where it gets very qualitative, right? So there's no real, like, you use 10% of this or whatever, but you look at the area that you want to survey, and then when Dr. Maganga was saying transects, we really wanted to zigzag through all the types of habitats that you can see. So, for example, if you're in a city and you see high-rise building and industrial use or any kind of different use, you will try to make sure to go through all of these areas. You wave through that area, covering all these different use types, but also avoiding the streets that you wouldn't expect dogs. So highways you wouldn't do. You would obviously try to avoid streets and, for example, pathways that you can walk on, because you don't want to be on the same street. So that's how you simplified, would try to make it representative and at the same time unbiased, but sort of still avoiding the places that you know for certain that there are not going to be dogs, like highways.
Yeah, and also not safe to serve, I would imagine, as well. So well worth
Fair enough.
avoiding those areas. Very good.
Yeah.
Tomorrow I'll let you have a look at the Q&A section, because there's a question in there for you as well. But for now, I'm going to ask I guess, a more general question that I'll then come to each of our speakers with. which is what is the most common mistake that you see programs make when trying to estimate dog populations. So I'm going to answer that in terms of HDRs, first of all. And I'd say that the most common mistake is that people may go to establish a dog population estimate in one particular location. They then use this estimate to calculate a human to dog ratio, and then they apply that same ratio everywhere. And we know that there can be quite big differences in human to dog ratios across a country, influenced most strongly by the density of people. As I described in my first presentation, in these very high density areas, you're going to get a lot of people per dog. And in the lower density rural areas, there's a lot more habitat for the dogs to live in. And so you may get more dogs per people than you would expect from that single average HDR. So really the recommendation is that you want to try and estimate numbers of dogs and therefore human to dog ratios in a sample of representative areas across those categories of urbanization. And then you can be much more skilled in your extrapolation to new areas. So you can take into account at least the local human density before you apply a human to dog ratio, possibly also looking at dominant religions within that particular area, and maybe even socioeconomics as well. So that's, I think, is the most common mistake I see, is the searching for a single HDR and then applying that blanket everywhere. So maybe I could go to Karma next. What do you see as the most common mistake in programs that are trying to estimate dog populations? You're muted at the moment.
Sorry. Yeah, this is a very good question, Ellie, because like the moment we talk about the dog, and when you want to do a dog survey, like even for the household survey, because like if you wanted to get the best representation, it has to be random. Firstly, it has to be sort of there should not be bias in the selection of the households. And then next important thing is even like selection of the areas, particular area, like within the strata, be it urban or rural. But then quite often, the moment when we talk about the dog, people deliberately, purposely select those areas which have higher chances of seeing the dogs. So when you go do this, actually, it's only going to overestimate the dog population, be it for the street survey or be it for the household survey. That's why what is really important is like the selection of the survey sites, number one, should be, and also the strata. And then also like the enumerators has to be properly trained. So that's why like my personal experience is sometimes when we do the training, okay, if I train a Bhutanese, since I'm from Bhutan, like when I do the training of a survey enumerators from Bhutan, it's easier. But then like when I do the same training in another country, because then I have to rely on the translator. And sometimes I'm also not really sort of confident that, okay, whether I managed to convey the message correctly. And then sometimes the estimates can be overestimated. Here, the question here is not really underestimate, but then the chances of overestimation is very high, because if you don't really sort of train the survey enumerators clearly on this, why I mean, like on the randomization, and then also like unbiased selection of the survey sites, households, those sort of things. Thank you.
Thank you, Karma. Yeah, I've definitely worked with survey teams before that have listened out to if they can hear a dog, and if they hear a dog, that's where they go and survey. And that is not the kind of bias that you need when you're trying to come up with a robust estimate. So you'll see in the very first section of the guidance document, it actually talks a little bit about sampling and how to set up a representative sample in the first place. So at least you can get your teams going to a representative sample first of all. But yeah, Karma has just pointed out the importance of making sure your enumerators understand that they need to be unbiased when they are selecting households to ask a questionnaire survey of as well. Thank you very much. Maganga, I'm going to come to you with that same question about what is the most common mistake you see programs make when trying to estimate dog populations.
I think the first one is about the representation. If like for transects, if you want to, most of the people will have the transect at the center of the village, where they are more likely the people close to that where a vaccination center is to count the dogs, and then you can have a very big coverage. So the issue here is to make sure that the transect is covering both the edge of the village and the center of the village purposely. You spend 1 hour. For us, we have been spending 1 hour at the center of the village and 1 hour at the edge or the periphery of the village to have the representation sample. And most of the dog owners, they don't live at the center of the village. Like example from Tanzania, they live at in periphery, close to the pasture, close to the bushes. So, and we have the publication on the land use and dog ownership. I will post it here. Thanks.
Thank you, Maganga. That's great. Tamara, I'm going to come to you with the same question about what is the most common mistake you see when people are preparing to do their dog estimation surveys, and then maybe you would like to answer live Naseem's question as well. Can I leave 2 with you?
Sorry, can you say the second part again?
Naseem's question in the Q&A box, which is about numbers. Did you see that one?
No, I did not.
Okay.
Absolutely.
I'll let you answer the first one, which is about what is the most common mistake you see people make when they're doing their dog estimation.
So there are a couple of things. So first of all, the thing that you said is I experienced a lot as well. Like, oh, the track says we go left, but I know on the right there's a pack of 10 dogs, so I'm just gonna make a detour. That's very classic. But also getting really distracted if it's like you have to know your survey teams. So if it's like 2 hours and they're very addicted to social media like everyone else, it's very easy to just get really distracted. So pointing out and being very explicit about, like, I know we all get distracted, we get calls and text messages and whatnot. Just try not to ruin, your survey by just getting distracted. And then being really, on it. It's really difficult, I think, to keep your attention for like 2 or 3 hours, and really reminding each other as a team, I think, to really pay attention to where you would expect the dogs. Because sometimes they're very open, but sometimes they're just curled up somewhere, sleeping under a car or something. So you need to be like more vigilant. And then obviously in the design phase, if you can't be unbiased, you should rather ask someone else probably to choose your routes. Because if you're so intimately familiar with your area, then it becomes really difficult to be unbiased. So I think being really honest about these things with yourself, I think it would be good.
Very good. And I've dropped Naseem's question into the WhatsApp as well, so if you might want to take a look at that and answer that one next. We've also got another general question here, which is about what local challenges, as in terrain, safety, or culture, affects data collection. Karma, I wondered if you wanted to answer this in terms of household surveys, in terms of particularly maybe around safety when people are doing household surveys.
Sorry, Ellie. So what's the exact question?
So the question is, what local challenges in terms of terrain, safety, or culture affect data collection?
I
have one
again,
that I was going to suggest
yeah.
for household
I
surveys.
I guess again, it's like depends from country to country. In some countries, there's no question but it's a problem more in the urban than the rural areas, because when we go to the rural areas, we will be able to meet someone, because normally we wanted to do this survey during the daytime, and then we always meet someone. But the challenge would be in the urban, because where people will be really busy, and then like most of the people living in urban area, they go for work and then they reach home late. And unless you plan to do this survey during the weekends, so it's quite challenging in these urban areas. But then again, in some urban areas, so again, we might meet different type of people. Like some people are friendly, but then not all people are very friendly. So yeah, that's my personal experience is more easier in the rural than in the urban. But the only challenge is we have to be bit careful because sometimes in some places the dogs may be very ferocious, and then you should be very, very careful to avoid getting bitten by the dogs. Because this is not uncommon, particularly when you go to the rural areas. In some communities, dogs are friendly, but in some communities, dogs are very ferocious. They will just try to attack you. So that's why, like, it's always better to go in pair, not alone. Yeah, yeah.
Absolutely. I
So
second
that's
that.
why, like, yeah. So that's why whenever, like, I sort of try to sort of train the enumerators, I always try to sort of teach them how to avoid dog bites, and then if they are attacked by a dog, so how they should respond. Those sort of, because there's a standard uh, guide or practices. So I always try to show that to the enumerators because that's really, really important. Because we are doing a dog survey, and then that's why, like, the chances of coming across a dog is very, very important. And we cannot like trust some of the dogs because some dogs might just come from behind and just beat you. So that's why, like, it's really, yeah, I think these are some of the challenges I see. Thank you.
Very good. And I second that comment around the sending your enumerators to do questionnaire surveys in pairs. So they've always got a backup of somebody else. Dogs may be an issue. Humans may also sometimes be an issue. And so they really should be
Yeah.
ready to support each other. And I've always said to them, you ask people politely if they would like to consent to doing a questionnaire. If you don't feel comfortable, you come up with an excuse and you get out. It's much more important to have your own safety in mind than get that questionnaire is not as important as your safety, I guess, is the key point that I try to make to them. That you don't feel comfortable, then leave. That's okay. And go to the next household. That's fine. Keep yourself safe. Maganga, I don't know if there was anything that you might want to note in terms of vaccination coverage when it comes to terrain, safety, or culture.
Well, safety first, if you're doing households, make sure that the owner of the dog is around because he's the one who will stop the dogs. And when you go outside from the owner's house, most of the dog, when they see human being, they will try to run in the bushes, so you'll be safe. But you need to be safe yourself on terms of the safety. And we train people on how to get to know the behaviors of the dogs or the data collector. On the train, when you have a steep terrain, sorry, it means you have very few dogs. We have the publication of land use and dog ownership. We have few dogs in those areas. And on the culture, we know that the Muslim, they tend to have fewer dogs. And then if you're doing transect, you need to have a long transect enough because detectability probability is much, much lower. But we know that in rural area and Christian areas, they tend to have more dogs. But in rural areas, the houses are sparsely distributed. So the houses are very far from each other. So all those you need to take into account. And then, so it will take a long time to complete maybe the survey or the household survey in the rural area based on the house arrangement. This you need to take into account. That is what I have from my side.
Very
Yeah,
good.
but also I needed to point out on the puppy and the adult ratio is very important to have a precise data because you have high chance to miss the dog, the puppies, but also most of the household members, if you ask if their dogs were vaccinated, they normally don't count puppies as part of the dog. So you need to be specific asking about puppies as well. Thanks.
Very good. Very true. Maganga, I'm going to ask you to take a look in WhatsApp. There's a question in there that I'm going to come back to you to ask in a second about 3 versus 1 year protection. Tamara, I know that I asked you, you've already answered it typed in text. So there was a question in the Q&A.
I was trying. Yeah,
That's
it's
fine.
a bit chicken and egg, but I hope that was helpful.
Excellent. So there was a question put in the Q&A by Naseem about the size of the team needed to survey a 10-kilometre square area, and Tamara's answered that already in the Q&A box, so you can see the answer there. Just to say something else around slightly around, I guess, terrain and culture. Well, I guess the question is around direct dog counts. There was a question that was asked earlier about whether you work dawn or dusk. And Tamara and I have done quite a few dog counts in our time, and we both of us tend to use early morning dawn to do our dog counts because the dogs tend to be more active. There tends to be lower traffic, which can get right in the way when you're trying to do your surveys. So we do tend to lean towards dawn. However, Tamara, I don't know if you wanted to make a comment on maybe looking at which time of day is most appropriate for your specific location.
Yeah, so yeah, you're absolutely right. I feel like I think the last time I was in Bali, people were telling me that we were doing like we were checking times like midday, evenings and stuff. And so if we talked with people, they would actually say, "Oh no, we see way more dogs in the evening." So listening also to the people that you are surrounded by will help you probably find the right time. But in general, I agree with you. In general, mornings are better. But then when you have, for example, Eastern Europe, if you're like in April, sometimes it's too cold in the morning as well. So really looking at these high versus low temperatures, etc. Yeah, totally with you.
Thank you. All right, I'm gonna come back to you to ask about this question that was what vaccine is used, 3-year or 1 year? How do you assess coverage using serology or physically?
Oh, that's a very nice question. Actually, if you're using the WOA recommended vaccine, like we have been using Novavax, it will protect the animal for 3 years. So what we have like experience from Tanzania, using the WOA recommended vaccine, we have over procured number of doses. And then as long as we maintain the cold chains, we vaccinated for the first round of vaccination. A lot of vaccine were remained. And then we used it for the second years. And then it was enough even for the second year. For the third year, and then there was out of the vaccine. But because of the logistic issues, we delayed for the second year. We just vaccinated a few districts, and then we couldn't complete for others because we didn't foresee, and at this time we didn't have transect survey. So what I can recommend that we don't recommend to do serological surveys as long as someone is using the WOA recommended vaccine. I think maybe Rachel, someone will post on the vaccine that has been recommended by WOA, and then that will be okay. Thanks.
Very good, thank you. We've got one new question here, which is any experience on the ethical approval requirements before surveys can be conducted. And I just wanted to mention that in the document, there's an explanation specifically around the consent statement that you should be asking at the beginning of household surveys. So you really should give some key information to every potential interviewee as you start the household survey so that they can decide whether they want to consent to the questionnaire survey or not. And the sorts of information that you're looking for is what you're going to do with the data, whether you're going to share it with anybody else, whether the survey is going to remain anonymous or not, and whether there are any contact details you can leave with them so they can follow up with you afterwards with any questions, or potentially to ask to have their answers removed from your data set, which they have the right to do. So if you look within the document, you'll see that there's an explanation of the consent statement that you must start every questionnaire survey with and the sorts of information that you should include. But does anybody else on the panel want to explain their experiences with ethical approval requirements?
I would like to say something because this is like you can always do the surveys and be unethical, basically. No one will hinder you, right? So to Ellie's point, I think it's really important to be transparent about how it's processed, how the data is kept, etc. But if you are asking because you want to publish, then you probably need a university IRB, so internal review board approval before you do your data collection. Sometimes they also do it retrospectively. But if that is why you are asking, then you should definitely have a university review board involved prior to your surveys. If you are not wanting to publish in scientific peer-reviewed publications, then I think what Ellie said is ethical and enough, because you give them everything that an IRB would probably also recommend and ask you to do. So yeah, in case you were asking about publication.
Very good. Anybody else got comments around this question of ethical approval?
Yeah, I think Tamara explained it very well. Like, for example, in my case, when I was doing this DPM study in Bhutan, more than the Bhutan is the Murdoch University who wants the ethical approval because that's the requirement of the university and the country. So I think when it comes to publication, yeah, Tamara explained it very well. But then, like, just to estimate the dog population, I don't think countries are very keen to have a ethical approval. But then, as Tamara said, if you wish to publish in a peer-reviewed journal, and then like this is again a prerequisite for some of the journals. So yeah, it's more with the academics and then also the requirement of the publishers.
Very good. Thank you.
Yep.
Maganga, did you want to come in on that one, or are you happy with the answers that have been given so far?
I'm very happy for the answer which have been given so far. ESCO is considered when you want to publish, but for the transect survey, we have been using the local. We train them to do, so they are familiar, and then we seek permission from the local authorities, and then you are ready to go. Thanks.
Very good. I'm not seeing any other questions in the Q&A. To my presenters, yeah, have you spotted any questions that you would like to answer that I haven't prompted you to do so yet? I'm having a scan myself.
Yeah, Ili, there's a question from Dr. Wakul Pati. How can we know the number of stray dog population in Pakistan? I think basically the purpose of this webinar is an answer to, I think, Dr. Wakul's question. Yeah. Ili, you're on mute.
Apologies. It's definitely worth looking at the HDR repository to see if there are any studies already there that you can lean on. And if not, then I think we're looking at probably at direct counts, possibly questionnaire surveys as well to see if there are any owned roaming dogs within the areas as well. But then doing that within a sample of areas to create reliable HDRs for Pakistan that take account of differences in human density and other predictors. Anyone got any other thoughts they want to share on that? Okay. Any other questions in the chat that any of you want to bring up?
There was a question on how many dogs is too many dogs. I already responded on the chat forum, so I don't think we need to have further discussion on that. Thank you, Ili.
Right. Well, unless there's anything else, then I am going to bring our webinar to a close. So I guess that just leaves me to thank all of you for attending, for taking your time to answer to ask questions. I hope that our overview today will make navigation of this new guidance easier. From the most simple dog population estimation, that is using those published HDRs, which is available to us all, we can today already get a rough estimate of dog numbers that allows us to get started with our vaccination campaigns. And subsequently, we can then refine those estimates using vaccination coverage, as Maganga explained. And for those of you with additional resources and time, Karma outlined using household surveys and Tamara described using direct counts to estimate dog populations in a sample of areas. And that would then allow you to develop HDRs that are then can be used to calculate dog estimates for wider unstudied areas, taking into account the characteristics of those areas, such as human density. I guess my final thank you for today must go to my presenters, my co-presenters and my co-authors as well. Thank you for pulling together this document. It's always an honour and a pleasure for us to contribute to the work of the United Against Rabies Forum. And I wish all of you that are listening your very best in your rabies elimination work. And we hope to hear more from you all in future. And that's goodbye from us for now. Thank you.